Well, good afternoon, Startup Health Festival. My name is Shameet Luhar, and I'm the CEO and co-founder of Vheda Health, and we're humanizing healthcare through technology. My co-founder and I were inspired to start Vheda Health after noticing a very alarming trend, which is that chronic conditions are fueling a cost strain on our insurance system worldwide, which is being driven by hospitalizations, ER visits, and deaths, all of which are preventable. And here in the United States, our Medicaid population contributes $150 billion to this problem annually. And so by not solving this problem now, we face a number of dire consequences, including a Medicaid population that will be continued to be unmanaged, and an insurance system that finds itself with an inability to effectively manage their costs. And so Vheda Health's Moonshot is to ensure that no person with a chronic condition ever has to set foot in a hospital. And we've assembled the right team to achieve this moonshot. My co-founder and I are health insurance industry veterans. Our last company, Resolution Health, was purchased by Anthem for $200 million, and we've assembled a team that is seasoned in scaling payer-focused technology companies from startup to IPO to acquisition. And these include individuals like Bradley Marks, who is responsible for 60% of Inovalon's revenue. And this team has been instrumental to getting us to where we are today. And so for health plans who need to decrease hospitalizations for their highest cost, non-compliant members, Vheda Health's mobile care management platform has been proven to save $17,175 per member per year by automating care plan compliance. And we achieve this by deploying a program our program on a smartphone that we ship. And we combine this with various biometric devices that collect real-time information that continuously identify intervention opportunities for our members prior to members being on a path to hospitalization. And our approach is different, namely by deploying our services on a smartphone that we ship, we control the full member experience, which ensures that our Medicaid populations are attaining the highest levels of engagement and compliance. And with real-time member data, health plans' care management teams now have access to make fact-based decisions. And what this results in is a staff multiplier, which leads to automating workflows that allow the health plan to prioritize their member needs in real time. And our best-in-class results are showing the following. We're saving $17,000 per member per year. Our Medicaid member engagement rate is 87%. And we're reducing hospitalizations for these members by up to 71%. And not only can these results be underestimated, but they fueled our momentum over the last 12 months. Just last year, we achieved $4 million in revenue. We've signed 6 health plans as new paying clients, including the second largest in the United States. And we've attracted more than 1,000 high-risk members who have more than $10,000 in annual spend, who have completed more than 2,500 live interactions and provided more than 175,000 device readings on our platform. And we know that chronic condition hospitalizations and ER expense is not going away. And so we have to act now, because if we don't, we face a Medicaid population that continues to be unmanaged, whose costs will rise, and an insurance system that will continue with an inability to effectively manage those costs. So if you are an investor, if you are a payer, let's start a dialogue so that we can ensure that no person with chronic diseases ever has to step foot in the hospital. Thank you very much.